What is arthritis and osteoarthritis? Arthritis simply means joint inflammation. There are many different types of arthritis, but in this video and website, JointPain.ie, we are going to be talking about the most common type, osteoarthritis, where osteo means bone. Osteoarthritis is a very common long-term condition, affecting hundreds of millions of people worldwide and about 1 in 8 people in Ireland. While it can happen at any age, it most commonly develops after the age of 50. It is also more common in women than men and may run in families. Other risk factors include being overweight, as this increases the load on the joints and the amount of inflammation occurring in the body, previous joint injury, and overusing a joint in a very repetitive manner, for example, due to your job. But why does osteoarthritis occur? First, let's take a look at a joint close-up. Joints are places where two bones meet, for example, your knee or hip. In between the bones is a smooth, tough, slippery material called cartilage, which cushions the bone, and a joint capsule, which is filled with fluid. During normal daily activities, our joints undergo low level of stress and injury, which is usually repaired. In osteoarthritis, however, the cartilage wears down over time, and the joint surface becomes rougher, leading to inflammation. Bony growths can develop around the joint, and extra fluid can build up, causing swelling. This leads to the main symptoms of osteoarthritis, which most commonly affects the knees, hips, hands, feet, and lower back. Joint pain and tenderness is usually worse at the end of the day or after activity. Joint stiffness usually happens after resting, for example first thing in the morning, but often wears off after movement. The joint may appear swollen or enlarged, or may make grating or crackling sounds. Muscle thinning and weakness can occur, and the joint may give way if it has become less stable. The severity of symptoms is different from person to person. For most people with osteoarthritis, the symptoms come and go, sometimes for no obvious reason, sometimes after using the joint more than you are used to, and some people find an increase in pain with things like changes in the weather, lack of sleep, or even stress or low mood. For a smaller group of people, the pain is more long-lasting and severe, making it very difficult to carry out normal daily activities. Your GP or other healthcare provider can usually diagnose osteoarthritis just by hearing about your symptoms. If they are not sure about what is causing the joint pain, they may use imaging and lab tests, such as x-rays or blood tests, to rule out other conditions, such as other types of arthritis. However, this is rarely needed. If you have osteoarthritis, try to stay physically active. Exercises that strengthen the muscles around the joint can help to relieve symptoms. Try to maintain a healthy weight and keep moving as much as possible. Continuing with your hobbies, your normal routine and social life can help you manage your condition. Continue to explore the website JointPain.ie to find out about the many ways in which the symptoms of osteoarthritis can be relieved and managed.